Could these 5 back pain myths be keeping you stuck in a cycle of pain? Maybe. So, I'm a physiotherapist. I'm sick of seeing all of the misconceptions, the outdated notions, the lies on the internet, all the misinformation, and the grifters trying to sell you a quick fix for a complex problem. Let's get into it. Number 1. A huge myth is that back pain must mean that something is damaged, and this just isn't true. This is a study that was done 10 years ago that took people with no pain, no symptoms, MRI scanned them, and found that people in their 20s, 37% of them had disc degeneration, meaning that the discs in their spine were starting to degenerate to some level at all. So, and this only got increased as people got older. Remember, this is people with no symptoms at all. So, unfortunately, someone can have back pain and then think, oh, I need to go and get an MRI scan, go and have a scan, and then they're told that they have disc degeneration, when that degeneration could have been there for years, and it probably was. So it wasn't the reason that their back was hurting, but now they're worried because they think, oh, my spine is falling apart. What can I do? I have to stay in this rigid position, so I can't really move, and that just perpetuates the pain and makes it worse. The same thing is true with disc bulges. They're more common as people get older, and they're very common and can be asymptomatic. Same is true for disc protrusions, when the disc is poking out slightly. Again, no symptoms, very common, increases with age, definitely not something to focus in on and think that it's the only reason that you're having back pain. So if you've had an MRI and you've been told that you have one of these, this is just a sample of the findings, then take it with a huge pinch of salt, because it's highly unlikely that it's just down to something that they find on an MRI. It's much more complex than that. The next one, this actually might be the biggest myth with back pain, is that your posture is causing your back pain. They say good posture, bad posture, what's the difference? And there isn't a difference, because there's no such thing as good posture and bad posture. But if you Google good posture or bad posture, you'll get given things like this that I've just taken from Google, where they say, if you've got a bad posture and your head is forward, that means you've got weak ab muscles. But this just isn't true. So there's no such thing as a perfect posture. Variation is much more important than any specific posture, ensuring that you're moving through the day. And if you're continuing to chase some imaginary perfect posture, you're never going to achieve it, firstly. And also, you're probably going to end up causing yourself more pain, because if you're trying to stay stuck upright in some rigid position, you're just going to be more tense, cause yourself more issues, and be worried all the time and amplifying your pain because you're not staying in that position. Who can sit like that all day? I know I can't. The third one. Core strengthening is the answer to your back pain. So this is based on a myth from back in the 80s, I think. But now there's more research showing that core strength is no superior to general exercise. So there's a study done back in 2012 where they took people with back pain, they got one group to do core exercise only and one to do a general exercise program. And to begin with, there was a slight advantage in doing the core exercise. But over a few months, they leveled out, like most things do. So what you really need when you have back pain is to be empowered with good information. Good information that says you're not broken, try and reduce your fear, try and move normally, try and live your normal life, and that's going to help you get back to normal. That's going to promote your recovery. Rest is best. So people, physiotherapists and doctors actually used to tell people to go and lay in bed and rest up until their pain settles down. But we found out that that's horrible advice. So just imagine the two scenarios. One person has back pain and they think, okay, I'll just lay around and not really do much until it goes away. And maybe it lasts for a month. In that month, they're getting weaker, they're losing fitness, they're losing confidence in how they move, their mood is lower. And then you've got someone else who says, okay, I'm going to go for a walk. You don't have to do it somewhere as scenic as this, but it might be nice. Who's going to feel better? Really? It's the person who's getting up and doing something. They're not going to make themselves any worse, but it's highly unlikely. And even if they do have a bit of a pain flare, again, it's unlikely they're doing any real damage to themselves. So, movement is definitely shown to promote recovery. It's one of the main ways that we advise people to get back to living their normal life. Number 5, you'll be in pain forever. Definitely not true. It can be chronic, but that doesn't mean that it's forever. So we class acute back pain as anything less than 6 weeks. And people actually overcome that with a basic intervention of just try and move normally. This is without specific physiotherapy input. This is just general guidance of try and live your normal life. 85 to 90% of people recover completely within 6 weeks. After that, it becomes subacute, 6 to 12 weeks. 70 to 80% of the remaining 10 to 15% will recover in that time frame. Again, with the same level of intervention of just try and live your normal life. And then chronic back pain, which is over 12 weeks, 50 to 60% improve significantly or completely recover within a year. So overall, up to 95% of people either completely recover or improve significantly within a year. And this is, again, just basic advice of try and live your normal life. Don't be too scared to move, stay active, those kind of things. So back pain is definitely not a life sentence. So just to recap on the 5 points. Pain does not mean damage. Just because it shows up on an MRI scan doesn't mean that there's something wrong with you. So please take it with a pinch of salt. Variation in how you move, how you sit, how you stand is always better than any particular single static posture. So rather than trying to act like you're in the military, slouch a bit, get comfortable, all right? There's no magical exercises. I mean, do core exercises if you want to, but do other exercises too. A combination is going to be what's best. Movement heals. If you're in a lot of pain, go for a little bit of movement. If the pain's going down, go for more movement. Listen to your body. It will usually tell you what it can handle at the time. And then chronic does not mean forever. So chronic is anything more than 12 weeks, but we still have a good recovery rate for people who are having long-term back pain. So again, I just want to put out good information and tell people the truth because there's so many misconceptions and lies out there on the internet that are really keeping people stuck in back pain. If you've been watching this long, thank you. Please subscribe. I'm going to keep putting out videos like this to try and give people the truth and empower them to help themselves.